And now we want to go to a health alert. A person in Texas has been diagnosed with bird flu after state health officials say they were in contact with infected dairy cattle. Joining us live this morning to talk more about the virus and the symptoms is our city's chief medical officer, Dr. David Purse. Good morning, Dr. Purse.
Good morning, Amy. Thanks for having me.
Yeah, so we heard a lot about bird flu. I feel like when chicken prices, egg prices went up. Is this the same bird flu we're talking about? This is in a human.
Yeah, so first of all, you have to remember there are a lot of different kinds of flus that are out there. I mean, every year the human vaccine changes because the virus changes a little bit. And so, but yeah, this is, similar to the ones that we've dealt with in the past.
Well, so what information can you share about this case in Texas? It's in the Panhandle, so it's not like it's right next door, but should we be concerned about that?
Yeah, so what I think is important to know is that, first of all, avian flu is not a new thing, and this particular strain is not new. We've been dealing with it for decades, and it has infected animals before. It's predominantly birds. That's why it's called avian flu, and it can be fatal to the birds. So it's important that the kids stay away from dead birds that they find out, when they're out playing around, and adults as well. It can get into, and this time we've got it into dairy cattle. It is difficult for it to go from the cattle to humans, although, as in this case, it can happen. It's also difficult for one person to spread it to another person. That's why we don't see these big outbreaks. Even though there's a lot of this flu in birds, and it can't get into farm animals, it really is difficult to get into humans, and we have a real hard time spreading it amongst ourselves. So that's all good news, and that has not changed.
Absolutely. And how does it spread? It says that's rare and it's difficult. What's the risk level, I guess, if it's difficult to spread? Is it airborne?
So the risk level remains low, but when it does spread, it spreads the usual way. The virus gets into the secretions, the nasal secretions, the coughs, the sneezes. And so if you're a dairy farm worker and you're working closely with the animals, you're going to be exposed to the saliva and the nasal secretions. And then if you become sick, your family members would be the first ones at risk. But in this case, well, first of all, it was identified in the cattle. Then all the farm workers were tested, and only one of them turned up to be positive, and he has been isolated and he's getting treatment right now. So the chance of it spreading is really, really low. It looks like the U.S. Department of Agriculture got on top of this right away.
All right. And then since we are talking about it being an infected cattle, and you're right, like I had not heard of that since it's the avian bird flu, primarily birds. Is there any sort of risk? I mean, we're eating that cattle. I mean, there's no risk there.
So that's a really good question. So first of all, these are dairy cattle, so we generally don't eat the dairy cattle. Now, the milk products that come are pasteurized, and this is an important point, and I'm really glad you brought it up. Pasteurized milk products are safe. The pasteurization process will eliminate the viruses and the bacteria. But there are some folks that like unpasteurized cheese, for example, and you can't get that here in the United States, at least not commercially. But you can go to our neighboring Mexico in the south and sometimes get it there. And I would strongly advise against eating anything that is an unpasteurized dairy product of any sort. Pasteurization will protect you. Unpasteurized, that's a risk.
All right. And then I didn't ask this right off the top because we're talking about the risk level being relatively low here in our area. But what are the symptoms of bird flu in a human?
Yeah, so good question. And this is what's really difficult about avian flu. The symptoms are the usual sort of flu symptoms. You get fever, you get body aches, you feel miserable. The one thing about avian flu that is unique is that it will often, but not always, cause conjunctivitis, red, itchy, burning eyes. The other thing about avian flu is that while it's really rare in humans and it's really difficult to transmit, it has killed people. Earlier this year in Cambodia, there were 5 cases. All of them, we believe the person caught it from a dead bird animal that they came across. There were 4 children, 1 adult, and one of the children died from it. So it's really important to make sure your kids stay away from dead birds.
Absolutely. All right. All very good information. Thanks so much for filling us in this morning, Dr. David Purse.
Absolutely, Amy. Thank you.